Hi, I'd like to talk to you about high blood pressure. It's also known as hypertension, and it's a serious health risk, and we should all take it seriously. The American Heart Association calls it the silent killer, and it has serious consequences. I know because I have high blood pressure, and I'd like to tell you some problems high blood pressure can cause and some measures you can take to keep it under control. I found out I had high blood pressure about 2 years ago. And I went to the doctor and told him my symptoms, and he agreed that I did have high blood pressure, so he put me on medication, and it's been under control pretty much ever since. Um, it's really important to go see your doctor. They're the only ones that can diagnose you, and if you need the medication, please take it. It helps, and it could save your life. Let me give you a little facts about high blood pressure, also known as hypertension. It is a disease. There is actually no cure. The American Heart Association says that 76.4 million U.S. adults have hypertension. High blood pressure readings a normal reading is 120/80, and the upper number is called the systolic number, and the bottom number is called the diastolic number, and it measures the rate of blood flow when you're moving and when you're at rest. So there's different stages of hypertension as well. There's prehypertension, which is your blood pressure reading would be 121/139/80/89, and then there is stage one. I'm sorry, I take that back. Stage one, and your blood pressure would be 140/159 to 90/99, and then there's stage two, which is 160 and higher over 100 and higher. And anything over 180, you need to seek emergency help. High blood pressure could be associated with heart attacks and stroke and kidney failure and other things as well. Some risk factors are the older you get, the more prone you are to hypertension. Your ethnicity plays a part in hypertension. Obesity, if you're overweight, losing weight would help that. Sleep apnea, if you have sleep apnea, that could also cause high blood pressure. Being physically inactive, that also attributes to it. Alcohol and smoking as well. Smoking does cause high blood pressure. There's actually no known explanation for it. There are signs and symptoms, but the doctors say it's asymptomatic. They say there are no signs and symptoms, but they have something called classical symptoms. They cause headaches and fainting and dizziness are some of the signs of high blood pressure. So if any of these things happen to you, it could be a number of things, but going to the doctor to find out what you should do should be number one. The treatments that are recommended are a modification, lifestyle changes, exercising. Exercising is the big one that helps bring your heart rate up as you're exercising. And as it comes down, your blood's flowing at the same pace going through your body, so it adjusts your blood pressure. Avoid smoking. If you smoke, stop smoking. Losing weight. Taking 10% off of your body weight helps bring your blood pressure down. And it may even help you not have to take the medications anymore. Your sodium restriction. Reduce your sodium in your diet. That's also number one. That you shouldn't add extra salt to your food. So, and reduce your alcohol consumption. That's another way to help your blood pressure stay down. Medications. The doctor can prescribe you medications. They have single dose medications, as you just take one kind of medication for your blood pressure, and it works continuously every day. You take it at the same time, and for 24 hours, it keeps your blood pressure down. Some people have to take multiple doses, multiple drugs for hypertension. They can prescribe you 2 or 3 different kind of high blood pressure medications, and you take those every day, like the doctor prescribes, and that can help control your blood pressure as well. The good news is that with the information I've given you, you can help control your high blood pressure and know your symptoms and warnings, and go to the doctor, and don't drink and smoke, and get off the couch and do exercise, and reduce your alcohol, and don't take chances with your health, and take control and responsibility for your hypertension. And it can save your life and lower your risk of heart attacks and stroke and kidney failure. And if hypertension's making changes now can keep your high blood pressure under control. Thank you for your time.